This is Peter Hill. Peter manages a hospital with 200 beds. How many decontaminated beds are available for new patients, and where each bed is located, Peter does not really know. Is the bed in room 1 on ward number 1 still occupied? Is it due for decontamination, and is it possibly an infectious bed? On ward 3, 3 decontaminated beds are being requested unexpectedly. Are there any beds available? If so, where are they located, and have they been properly decontaminated according to applicable health and safety regulations? Peter Hill has no answer to all these questions. Yet he ought to know, because according to applicable hygiene laws, a hospital bed must be decontaminated before being used for a new patient. Since Peter Hill cannot prove that his staff has acted in accordance with hygiene and infection control standards, his chances in a liability court case are poor. However, there is a simple solution to Peter Hill's problems: the Hygiene Process Management Tool by Clinaris, in short, HPM. With HPM, Peter Hill has a perfect management and controlling instrument for his entire stock of hospital beds. An integral part of HPM is the use of barcodes which are mounted on beds. Barcodes are used to scan each bed's status and location, from the request for a decontaminated bed, the taking over by the gopher services to the decontamination department, and back to the ward. By means of permanent data gathering, hospital staff does know the exact location of each bed and hence is able to identify decontaminated beds without delay, saving time and distances in the process. At the heart of HPM is its database. Through the permanent collection of data, Peter Hill is in a position to obtain a complete overview of the status and whereabouts of all beds in his hospital at any point in time and can thus react accordingly. HPM has many advantages for Peter Hill. By way of data gathering and data processing, Peter Hill is able to plan his staffing according to demand criteria. This allows him to potentially save on personnel costs. Since Peter Hill can make use of improved processes whilst at the same time being fully compliant with hygiene regulations, he may have access to more decontaminated beds at any given point in time. This opens up potential for increased sales and profits. Peter Hill is now in a position to prove at any point in time that he is fully compliant with hygiene regulations, thus protecting personnel, patients, and visitors. Through all these measures, he may even be able to lower the costs of his general liability insurance. HPM facilitates the day-to-day management of hospital beds through its planning and validation function, all of this at a cost lower than the expected benefits. Interested? Contact us. We are happy to advise you.